talk about diabetes and foot care, and just generally what we are doing to keep our feet healthy. So for some people, what we're going to talk about today may be things that you already know, but for others it may be a build on some of the knowledge that you've already got. But what I hope to do today is maybe give you some little gems to try and keep your feet nice and healthy, to try and keep you nice and mobile, so you can live a healthy, happy life. So they're the things that we're going to try and aim for today. So as we are talking about the feet, I think it's important to have a look at the foot in the first place. So the foot is a fantastic structure. There are 26 bones in the foot, and there's 107 ligaments in each foot, and there's around 20 muscles, 33 joints, and there's 2 main arteries that come into the foot, and there's 2 main nerves that come into the foot, which split off into 5 branches. But did you know that if you added all the footsteps that you walk in a day, you would walk the equivalent of 4 times around the world? So you can see how much your feet do for the body. The need to keep them nice and healthy is really paramount, because they help support us, they keep us mobile, and they keep us healthy. So it's really important to look after our feet. So I'm going to be talking about diabetes and feet. So there's 2 types of diabetes. So, well, there's lots of types of diabetes, but the 2 main types of diabetes is type 1 diabetes, where your pancreas doesn't make enough insulin to bring the sugars down to the levels that they should be. So the treatment for patients who may have type 1 diabetes is usually insulin, and sometimes you may need to take a tablet as well. And also you need to have maybe look at your diet as well. So it's all related together. Now, patients normally with type 1 diabetes are younger, usually under the age of 14. Sometimes the younger ones are coming up with type 1 diabetes. But again, the thing to remember is that pancreas doesn't make enough insulin, and therefore the treatment for this is actually insulin. The second type of diabetes is type 2 diabetes. So the pancreas is making some insulin, but not enough insulin to bring the sugars levels down to where they actually should be. Now, there are some risk factors to consider, to which make you more predisposed to developing type 2 diabetes, and these are things like high blood pressure, high cholesterol, but you may also have genetics. So if you've got individuals in your family who have got diabetes, you may be genetically more predisposed to getting type 2 diabetes. And usually this onset of this particular diabetes is as we get older, and the treatment again is diet and exercise to get those sugar levels down, and tablets, and now possibly insulin as well. But these are all decisions that will be made with your healthcare practitioner as to what's going to be best for you. So the thing to remember with diabetes is that it's a silent disease. It does affect the whole body. So it's not just about your sugar levels and keeping the sugar levels down. It affects your circulation. It affects the nerves. So you may hear people talking about something called neuropathy. So what neuropathy means is that there is a nerve damage, and we're going to talk a little bit about neuropathy in a moment. Our immune systems don't work as well, which means that you're more likely to get an infection. And if you get an infection, that infection might get worse very, very quickly, because the immune response, so your body, which would fight off the immune system, is not working quite as well as it should be. You may end up with heart damage as well. You may end up with eye damage, which is also known as retinopathy, or kidney damage, which is nephropathy. So it's really important that if you get letters for screening, which is looking after these organs in the body, that you attend to these screening appointments, because they're all about looking at what's going on within the body. So let's have a look at, first thing, poor circulation. So there's a few things to remember when you've got diabetes. So the first thing is that it can cause poor circulation. So the risk factors, as we've already said, are high cholesterol, high blood pressure. But the other thing is, if you've got lots and lots of sugar in the blood, that can also affect those arteries. And if you are smoking, that furs up the arteries quicker. And if you've got maybe a high intake of alcohol as well, this will all contribute to having a poor circulation. And basically what happens is, as you can see in these two pictures here, is that the inner part of that artery gets damaged, and therefore it gets more and more narrow, which means that there's less blood that can flow. And if you think where the feet are in comparison to the heart, they're the furthest away from the heart. So the blood needs to flow the furthest. So it just means that they're more at risk of developing problems if we've got problems with our circulation. So how do you know that you may have poor circulation? Sometimes you may find that your feet are cold, or one foot's cold and the other foot feels warm. You may notice some changes in the colour of your feet. Now, this might not be so pronounced if you've got maybe brown skin. So redness doesn't show particularly well, but it's really, really important to look out for those subtle changes in the colour, which may indicate that there are changes to the circulation. Your skin may be really fragile and really quite thin. And also, if you've got poor circulation, the actual nails on your toes get really, really thick, and they can become really difficult to actually manage and keep on top of. So what I would recommend is maybe getting a file to file the thickness down, or see someone who can safely cut them, maybe a podiatrist or a family member who can actually get some of that thickness off those nails. But just as much as it can cause thick nails, it can cause thin nails, which can break off as well. The other symptoms to look out for poor circulation is pain when you're walking. So this is indicating that the oxygen, the muscles that need the oxygen, when they're walking, the muscles aren't getting the right amount of oxygen. And you may hear the word claudication. Intermittent claudication is what they call this particular symptom. When you're actually walking and you start getting the pain at the back of your legs, at the back of your calves. And the only way to stop that pain is by stopping and resting. And if you get pain when you're resting, so that is if you're in bed and you start getting cramp at the back of your calf muscles, and the only way that pain goes is by dangling your foot off the end of your bed. That's called rest pain. So these are all symptoms to show that maybe there are signs of issues with your circulation. It's really important that if you have anything like this, that you get some help and some advice from an appropriate health practitioner, be that your district nurse, practice nurse, district nurse, your GP or podiatrist. So everyone, as part of looking after their feet, should be getting a foot screening. Now, this foot screening might be done in your GP surgery. It might be done at your local podiatry surgery, or if you have private health professionals, private podiatrists, they should be doing these foot checks. And what they do is they will check your circulation. So the way they do it is they feel for the arteries with their fingers. Now, I don't know whether you've ever looked for the pulses in your foot. I certainly get my children just to lift their feet up and say, well, can you actually feel your pulses in your foot? And that might be something, if you can reach your feet, you might want to do. But there's one at the top of the foot and the one near your middle ankle. So the podiatrist or the health professional will have a feel for the pulses. They will also have a listen to the sounds of these pulses using a handheld Doppler, and that will give an indication as to what the health of those arteries actually are. They will check the temperature, check your skin condition, and they may also do an ABPI, which basically looks at the actual condition of those arteries, and it gives an indication of whether they're hardened, whether you need any extra referrals onto the vascular teams. But it's important to realise that actually when you've got reduced healing or poor circulation, that can mean that if you get an injury, that healing is reduced. So it's really important to keep your circulation good. So we always advise a healthy diet, keep that exercise, keep walking, keep those arteries and those muscles nice and healthy going forward. The other thing we were talking about earlier was neuropathy, which basically means nerve damage. So diabetes does cause nerve damage. And again, it's neuropathy. And there's 3 types of neuropathy. And up to 50% of people who have got diabetes will end up with some element of neuropathy. Now, the treatment for neuropathy is keeping your blood sugar levels as in good control as possible. And if you have got pain because of neuropathy, you may need medicine or tablets from either a consultant or a GP to manage that pain a bit better. So the first type of neuropathy is sensory neuropathy. So this is when you lose that protective pain sensation. So you may stand on something and that ouch feeling you should get, you don't have. Now, you may be listening and thinking, oh, I get pins and needles sensations, or I might get throbbing sensations. And people come to me and say that they feel like someone's stabbing a knife in their actual foot, or the foot goes completely numb. Sometimes people say that they've got a burning sensation and like an electric shock that's actually happening, or that when they're walking they feel as if they're just walking on stones. Now these are signs of sensory neuropathy. Now you'll be thinking, well so what? Well, the reason we talk about sensory neuropathy is if you had some sort of trauma. So if you were to stand on a sharp stone or a glass or a pin, for instance, or Lego in my case with having children, you might not necessarily feel that. So if you can't feel something, it's not a problem. And this can be quite dangerous, which means that you may end up with injury to your feet and not realize. The other thing is if you get friction in your shoes and you can't feel, you can end up with blisters and ulceration on your feet and not realize because you haven't got that sensation that will tell you that you've got an injury. And the other thing is heat. You might not be able to tell the difference between hot and cold. So it's good to check with your elbow the temperature of your water before you get in, and check with your elbow the temperature of your bath before you get in, to make sure that the water is actually the right temperature. But that also goes for hot water bottles. You might not necessarily feel how hot that hot water bottle is. Now, in my practice, I've had lots of burns to the feet and legs where people have maybe sat in front of the heater and not realized that heat was actually cooking their legs. So it's really, really important to keep an eye on this. The other type of neuropathy is motor neuropathy. So this is where you will notice changes to the shape of the foot. So you can end up with muscle weakness, and you can get deformities like high arches, which mean, as you can see on this picture, that big toe area becomes more pronounced. So when you're walking, you've got lots and lots of pressure, which means that hard skin can then form, which can then mean that you're more at risk of ulceration. You might find it more difficult to find shoes because the toes normally claw. So you need something that's going to be a lot deeper than normal shop footwear. But the other thing you might need to do is have tighter shoes, because with neuropathy, you need to know where your feet actually are on the floor to feel safe. And people normally wear tighter shoes in order to get that feedback to see where their actual feet are. The other neuropathy we're talking about is autonomic. Now, you may have noticed changes to your skin, where it's getting drier. And it's not just the feet, we're talking about the whole body. Now, this is autonomic, so the sweat cells stop working naturally, which would secrete the oils into the skin, keeping your skin nice and supple. So what happens is that you get dryness, and we're talking about feet. So I've got feet pictures here, but it can affect the whole body. You may get cracks, which may or may not be painful depending on whether you've got neuropathy, but these cracks could get infected. So it's really important that you treat them. Now, I always recommend a urea-based cream. These photos are from a Flexitol, someone using Flexitol, and the different percentages of urea in the cream, but there's lots of other brands out there like Ursarin. I know Wilkinson's have got their own brand of urea-based cream, but that will help address the dryness to the skin. Now, if the cream alone doesn't help, you may need to see a podiatrist to take all that hard skin down in order for you to then keep applying that cream to keep the skin texture nice and supple. So the other things that we need to be aware of is that your ability to fight infection may be reduced. So if you get an infection, it may spread quicker. And if you haven't got feeling, it may go missed. You may not realize that you've got this problem going on with your feet. Now, the signs and symptoms of infection to look for are things like redness, heat, swelling, maybe discharge, which has got a smell. So they're the sorts of things you need to be looking at if you're looking for any sort of signs and symptoms on your feet. And what do you need to do? Have dressings available, dry dressings to put over the top of the injury, but know how to get help. So know the clinic numbers, your local podiatry clinic number, for instance. How would you get help if you noticed a foot ulcer? So this may be via your podiatrist, it might be through your practice nurse, it might be through your GP. But if you've got an infected ulcer on the foot and it's over a weekend, you might even have to go to out of hours to make sure you get the antibiotics so that that infection doesn't get worse and it doesn't spread. The other condition I just wanted to quickly go over is a condition called Charcot. Now, this condition normally presents as an unexplained red, hot, swollen foot. Now, it's normally one foot, not the other. They don't know what starts it off, but usually it's after some sort of trauma. Maybe you've done extra walking or you've actually tripped. But what happens is this foot, the bones within this foot become really, really soft, and the foot can actually collapse. So it's actually quite a serious condition which could get missed. Now, the treatment for a Charcot is normally these moon boots, you know, these grey boots that all the footballers are wearing. They're called an air cast boot. And the treatment is about mobilizing that foot so that foot stays in that structure for as long as possible. And this is normally done under a multidisciplinary team with consultants and podiatrists and orthotists and diabetes specialist nurses, all working together to help preserve that foot. And the duration of treatment can be anything from 12 to 36 months. So it can be quite a long treatment for it. But it was a condition I think we don't talk about a lot, but it's something just to be aware of in the population. So for yourself, I would advise know what your risk status is. So when you go for your foot screening, ask the person who is doing your foot screening, what is my risk status of developing a problem? So you can either be a low risk, an increase or high risk, or have active pathology, which basically means that you've actually got an ulcer already, maybe some sort of gangrene or a puncture wound or some sort of a new swelling. What knowing your risk status does is helps plan what your future management is going to be going forward, because what we're trying to do is prevent any problems from happening. Prevention is better than cure. So knowing your risk status allows further management to happen. And know what your HbA1c is. Now, I have lots of conversations with people about HbA1c, and people ask me, they tell me they don't know what HbA1c is. So this is an average of what your sugars have been over the last 3 months. So the red blood cell has a shelf life of 3 months. And what this test does is it checks the sugars that have attached themselves to this red blood cell over the last 3 months. So if there's lots and lots of sugar, it means that your control hasn't been particularly good. And if it's not got a lot of sugar, it means that your sugar levels have been low. And this is normally found out via a blood test. You may have a blood test prior to going to your review appointments with your health professional, but it's really important to know what your HbA1c is. Now, the HbA1c ideally would be nice to have it around 48, but as you get older, that might need to be a little bit higher, because if it's too low, it might make you dizzy and make you more at risk of having a fall. But it's really important to know what your HbA1c is. So what can you do to keep your feet healthy? So it's really important to check your feet. Get a family member to check your feet if you're not able to do so. And what you're checking for is changes to the shape of the foot, any open areas, any cuts, any blisters, any signs and symptoms of infection, any ulceration. So there's some quite good ways that you can try and do this. If you live by yourself and you're not able to get anyone to check your feet, perhaps a big mirror with a long handle. And I know over this COVID period particularly, I've been asking people to use a selfie stick. So you put your phone to the bottom of the selfie stick, take a picture underneath of your foot, and then review that photograph to see whether there are any cuts or bruises or any open areas to that foot. So a selfie stick can also help check underneath, because as we get older, we might not be so agile to be able to get our feet up and have a check. And our eyesight might not be so good to actually check to see what's going on. And as people keep telling me, your feet get further away from your body the older you get. So these are some ways that might help you check your feet. Have a good foot care routine. Wash your feet in warm water. Make sure you dry your feet. Make sure you dry in between your toes and apply cream, but don't apply cream in between those toes. And if you notice an open area, don't neglect it. Put a dry dressing on to protect it. Do not walk barefoot, because actually if you're walking barefoot and you've got neuropathy, you might not necessarily realise that you've actually got a problem. You might injure yourself or stand on something and not realise. So don't go around barefoot. Have some good, well-fitting slippers. Well, like we've said earlier, don't sit too close to the heaters, and be aware of the hot water bottles, and never use corn plasters, because corn plasters not self-limiting. The acid will continue to burn that skin and not stop, and you can end up with a big wound on the foot without you realizing. Try to give up smoking if you are smoking, because that affects your circulation. Try and keep your blood sugar control as within the normal parameters as much as possible, and keep your blood pressure as good as it can be, and get help if you do run into problems. Don't worry and at home by yourself. Seek the help you need to manage the issues that you've got, and attend any of your screening. I know I've put foot screening here, but attend your retinal screening, go to your GP's appointments, attend your foot screen appointments, because it's really important to do that. It's also important to wear good shoes. So people ask me, what is a good shoe? So a good shoe is one that's going to be wide and deep enough to house that shoe, to house that foot. So a good way of doing is standing barefoot next to that shoe to see whether your foot's going to be squished in that shoe or not. You may end up with problems like friction burns or blisters, because you can't feel what that shoe is doing to the actual foot. So it's really important to wear good fitting shoes and slippers. So we always talk about them being deep, we talk about them being wide, and we always talk about having a fastener to hold the shoe in place and make sure that it grips really well around the heel. And like I said, stand next to that shoe to see whether that shoe is going to fit the foot properly or not. And remember, the more expensive the shoe doesn't necessarily mean it's better for you. It's actually looking at the shape of the shoe itself. And wear socks if you can, because that will stop the friction burns to protect the foot. But thank you for listening.